My name is Shannon Heffernan, and I am one of the social workers at the Valerie Fund Children's Center for Cancer and Blood Disorders at St. Joseph's Children's Hospital. We are the youngest Valerie Fund Center, joining the fold in 2016. Let me tell you a little bit about what I do and the services we provide to our patients and their families. Social workers are an essential part of the Valerie Fund team. While the number and role of the social workers may vary slightly from center to center, our goal is to provide emotional support, clinical assessment, and mental health and emotional interventions to the children, their families, their siblings, their parents, and sometimes even their community. At St. Joseph's, we have two social workers. I am the oncology social worker working with children with a cancer diagnosis. My colleague Maria Luisa Molina is the hematology social worker working with children with sickle cell disease and other blood disorders. Our roles are similar in that we are working with children with chronic and/or life-limiting diagnoses, and our interventions are ongoing, tailored to the developmental age of the child and where they are in their disease trajectory. We are master's level trained clinicians who help families cope throughout every part of the disease journey, from understanding and adjusting to their medical condition and treatment plan, to navigating financial, social, and emotional issues, to assisting with the transition to survivorship, or in some cases to end-of-life care. Children with cancer and their families often need someone to talk with about their feelings, their fears, and their experience. Social workers are that sounding board. We create a safe space where we listen, help families to process what is happening, and provide interventions and build coping skills. A diagnosis of cancer impacts the entire family, and so our work is geared to each family member and their individual needs. We refer a lot to the new normal. For the child in treatment, we help them adjust and understand their diagnosis. This may entail helping them to accommodate to the new identity of being a child with cancer. What does this mean? How does this affect how I see myself? How do I interact with my friends? How do I navigate romantic relationships? And how does it affect my normal routines, such as school, sports, or extracurricular activities? For the parents, we work in helping them juggle their many responsibilities, how to be present with their child in treatment, how to balance work, to pay bills, and in many cases, to support and care for their other children. For the siblings, we help them understand what is happening to their brother or sister, what feelings this triggers for them, and how the treatment will affect their daily routine. Working in pediatric oncology is a collaborative effort. I work hand in hand with the rest of our multidisciplinary team, which includes doctors, nurses, child life specialists, educational liaisons, etc. I'm present with the doctors when they disclose a diagnosis or during consent conferences to ensure that families have emotional support and are able to fully understand the complicated medical terminology provided, since being able to fully understand their child's diagnosis is key to their treatment. Part of my role as a social worker is also to empower our families and patients by helping them to advocate for their child's and their family's unique emotional, medical, and academic needs. Being able to work with our families is an honor and a privilege. Words cannot describe how proud I am to be a social worker at the Valerie Fund Center and being there for our families when they need us the most.
My name is Jill, and I am the Child Life Specialist at Newark Beth Israel. Child life and social work are the cornerstones of the Valerie Fund programs that we offer to over 6,000 children with cancer and blood disorders each year. Let me tell you a little bit about what I do as a child life specialist. Upon diagnosis, I provide education about the patient's illness and treatment in child-friendly language, and also through the use of medical teaching dolls and age-appropriate books. I will show the child the central line they are getting on the doll, and using these types of educational tools with the child helps them to open up and ask questions so that we can clear up any misconceptions they may have. We recently had a new diagnosis, and I used the doll with her to show her the port and how it worked. We also read a story about hair loss due to chemotherapy, and also about how your hair will grow back. Another part of my job is therapeutic play. I also use the doll for this so that the patient can be the doctor or nurse, and the doll is the patient. Through this play, the patient is able to express themselves and show their perception of how treatment and procedures are done. I also use these types of play with the new diagnosis, and she was able to access the port on the doll. I am also available for procedural preparation and support. I will talk to the patient about the procedures they are going to have and use visual aids such as dolls, books, and even apps on the iPad. During the procedure, I will be with the patient for support and provide distraction with an iPad, and sometimes we listen to music and sing favorite songs or go through pictures and talk about pets, and some patients just blow bubbles to practice deep breathing, and sometimes we just talk. Through all of these interventions, I am helping to normalize the hospital environment and provide developmental and emotional support.